I think we can get started because, as we were just discussing, we all have a lot to say about this topic. Our panel, myself, all of you attending this webinar. So very excited that you're here, and we'll get started. Today, our Trends webinar from the Center for the Promotion of Health in the New England Workplace is Building a Stronger Front, Union Leaders Unite for Member Wellbeing in the Workplace. We're going to be talking about mental health and well-being in the workplace with our panel, Chris Pontus, Amy Baruth, and Tara Keaton. They'll each get an opportunity to introduce themselves. And I'm Cora Roloffs. I'm a researcher at CPH-NEW. And what we're going to do today is we're going to talk about this topic of stress in the workplace from the union and worker perspective. And we all know that this issue has been gaining more and more prominence in the public health realm and in the public sector, and in particular in response to the stresses and challenges experienced during the COVID pandemic. But of course, we all know this has been here all along. And last year or the year before, our Surgeon General produced this incredible report on workplace mental health and well-being, raising its prominence as a topic even more, and with this very interesting framework that centered worker voices and equity. NIOSH also has been making sustained attention to this issue of mental health in the workplace. They have a fairly recent science blog on the topic, as well as a recent article in the peer-reviewed literature on the topic that I recommend both of those. And NIOSH really says what, the science supports and what we believe, which is getting to the root of workplace stress through organizational culture changes that center workers' mental health and respect boundaries between work and non-work time. And although there may be a response to stress that says, get therapy or do self-care, we know that as practitioners of health and safety, we want to get to the root of stress and eliminate those root causes. And one way to do that is increase worker control in the workplace. The blog also mentioned the role of supervisors in making it fun or really not fun, and putting recommendations in for training on supportive supervision, and also for training workers on stress management and reduction. So NIOSH is leading us there. Our own work at CPH-NEW, if I were teaching a course on health and safety, I would certainly put this in this article written by one of our co-director emeritus, Laura Panett, on that really is an excellent survey of issues related to work-related stress and what can be done about it. We have been addressing worker stress and mental health in all of our intervention projects, healthcare, education, corrections, and in the unions using our Healthy Participatory program. And my own project on employer crisis preparedness centers employee mental health, preventing the mental health impacts of disasters. We have a new course on this topic, and we hope that you all will take this. So with that, I have this video, which the point is this is sort of comes from an employer's perspective, the Henry Ford Health Center, about how to deal with stress, and it has what we might call the sort of regular approaches to coping with stress, such as stretching and exercising and breathing and listening to music and eating chocolate and drinking tea, etc. So I'll just stop this. They do end this with take a walk, and that might be the one thing we might see there as being particularly beneficial, is to take a walk and maybe to keep going. Now here is another union perspective. Last year, we certainly saw this enormous national strike of the UAW, and the approach of the UAW, better contracts, and now within and beyond the contract, reducing the number of work hours. as being an approach to reduce stress. Reduce the stress level in the country, allow Americans to enjoy a better quality of life was a quote from Senator Sanders in the hearing that was held on reducing the work week. So that is what I have for introducing, and we will turn now to our panel. First up, let's have Chris Pontus, if you want to introduce yourself and a little bit about how your union is addressing this issue. We'll have lots more time for going into detail. So this is just the short introduction.
Okay, I'll keep it brief. Hi, my name is Chris Pontus. I am an occupational health nurse in the Division of Nursing, and my specialty is health and safety. And thank you for this opportunity to share what we're doing at M&A, Massachusetts Nurses Association. And what we do right now is respond to a lot of crisis, because that's what nursing and healthcare is in, unfortunately. The prevention mode was practiced prior to the pandemic, but just to keep it neat and speak the truth, right now we are most often in crisis mode, and I'll speak to that, how we're addressing it. Thank you.
And Tara, would you like to go next?
Good afternoon, everyone. My name is Tara Keaton. I'm a captain at the Connecticut Department of Corrections, and I'm also the executive vice president. I'm the lead facilitator of a design team that works for the correctional supervisors, that works alongside the UConn research team to develop a curriculum for our annual wellness training every year. Thank you for having me.
Wonderful. Thank you for being here. And Amy?
My name is Amy Baruth, and I'm the Deputy Director for our Occupational Safety and Health Program within the Health Issues Department at the American Federation of Teachers. That's a mouthful. We represent over 1.7 million workers across 5 divisions, including K-12 teachers, also K-12 support staff, such as custodians, paraprofessionals, bus drivers, secretaries, maintenance staff, and the like. We represent public employees in state, county, and local government, higher education faculty and staff, and healthcare workers, including RNs, physicians, and environmental service personnel. So we have a lot of variety in the folks that we represent. The one thing that is consistent, the issue of well-being is a primary concern because our members are struggling. Across all of our divisions, education, healthcare, public employees, doesn't matter. We're all facing hugely stressful events in their work lives, including being overworked, underpaid, facing alarming staff shortages in all aspects. It's not just healthcare, it's not just education, it's across the board. And really being demoralized by attacks on their professions. Many times our members are pointed back to personal strategies to deal with the stressors they face in the workplace. And that can be somewhat helpful, but our goal at AFT is to address these stressors at the organizational level, which is a difficult task in most workplaces. It takes a lot of strategic planning, an organizing plan, if you will. We have great experience with that at AFT, and that's really our goal, is to take this on, because dealing with things personally is just that, right? But you still have to get up and go to work on Monday morning and deal with the stressors that are in the workplace. And we need to figure out how to make workplaces better for our members. Thanks.
Thank you so much, Amy. Maybe then I'll switch and ask Tara, sorry, if you want to address actually what Amy was just talking about the organizational approach that you've been working on in corrections to address some well-being issues.
So in 2014, my predecessors, they developed a design team with the UConn staff because they seen a rise in the deaf in correctional supervisors. So they decided that that was a problem. So they joined alongside UConn and developed a design team, which usually consists of 8 to 10 members, and then the UConn researchers. And we develop a curriculum of issues that we see our members are going throughout that year. So we have developed a sleep app, because a sleep app and a sleep study for our members. We developed a mental health training. We've developed a healthy eating training. And this year, our training is focusing on ideas for a healthier future. because we see that the lifespan of our members is getting shorter. And also, we're also trying to change the culture in corrections and have our members realize that you're part of the culture, but you're not the culture. And to kind of have our members be able to work in a healthier environment, and think about their well-being as well as the offender's well-being, and realize that if we have a healthy staff member, that it makes a healthier offender. So we
Okay.
develop curriculums every year. We have in our contract, we've developed an annual wellness day. My predecessors have they negotiated with the state. We get some funding, and we also get 1 day a year for annual wellness training, which the training is created by the design team, and every year we give them their annual wellness training, and it's negotiated in our contract.
And some of the issues that Amy was mentioning in terms of understaffing, I think that's probably been an issue for you as well. And I'm just wondering if that has been part of the discussion with DOC on ways to reduce stress.
So it doesn't necessarily affect the supervisors,
Mhm.
only because coming into our unit, you're obviously an officer, and then you come into the supervisor's unit. But yes, it is an issue with the officers and the nursing staff. And yes, the DOC is aware of it, and they are trying to do programs, and they also are working alongside UConn researchers develop with a program called High Tech, where they're trying to overall develop some with the help of the unions, develop some practices that we can develop within the agency to have a healthier staff member. But yes, they're fully aware of the staffing crisis, but they have been doing all that they can, like, to promote and get as much staff as we can. It's just really hard now.
Yeah. Chris, if you want to you want to speak to this issue of some things that M&A is doing?
Yeah, and amongst the pandemic prior to and even currently, we do have health fears. It's not like we're in constant crisis every day, which we are with the membership, but even with those who support those members, we have an internal wellness or health fear yearly, and then we offer education programs. So it's not that we're always in crisis mode. We are, but concurrently in education mode, and also organizationally using pathways to reach our members for a prevention method, if you will. So there's many plates spinning at the same time. But I will say that for our membership, when a certain segment of those people or those nurses, because we have doctors, psychologists, we have a pretty good span of members other than nurses, but primarily when the nurses are in deep crisis, we will respond. For example, we had a group of ICU nurses last week who we actually brought a psychologist to them on site because they were affected so deeply by a situation. So we find that we're doing things at M&A that we never thought we would do, that we assess the situation now in our responding in ways we have never in the past, because it's becoming that acute.
Right. So maybe actually not everyone may know what the major sources of stress in the workplace are for your members. Maybe review what some of those are.
Okay, so what led to that? It was where we have a group of 8 hospitals that are currently being closed, or looking like they may be closed. So those nurses, after coming out of a pandemic, they may be losing their jobs. And it looks like, politically, there's not being much done in Massachusetts to save them right now. So they're under a tremendous amount of stress. It's been in the news, so I can say it clearly, it's a Steward situation. So 8 hospitals were bought out by a private firm, and that firm is now going bankrupt. So we currently have thousands of nurses under under an amount of stress they've never been in their whole life. And some of them are looking to leave. So we're trying to hopefully get them new jobs and to help them deal with their daily situations. People dying in the corridors in the medical centers, for example. The equipment being sold in some of the hospitals and losing a child. So we're talking that amount of crisis, that level of concern. So I'm not exaggerating this. And that's
Right.
where our attentions have gone.
Right. And of course, the issue of violence in the workplace is an acute one, and understaffing. M&A tried to,
And
Re-
all, yes, and I
reproduce.
don't want to overspeak it but yes, all of that. And it's taking its toll, but so we're trying to, we're educating people through programs. We bring programs out to different regions with expert speakers, and we organizationally, we have congresses and task force. So we have different methods and different pathways to address it.
right.
Thank
And
you.
Amy, did you want to share slides to talk more about the AFT's approaches?
Sure, I can do that. I would like to share a couple. So we've done a lot on this, both in education and healthcare, looking at the issues of burnout and just all the stressors that are occurring in the workplace for our members. It's quite a lot. But last year, we partnered with Educators Thriving and did a whole year-long study that resulted in this report, Beyond Burnout. And it's really a research-based look at solutions to improve some of the chronic levels of stress that our members are facing and the burnout they're facing. It's not just teachers, it's support staff at all levels, teacher shortages, bus drivers, everybody. It's a very difficult time in education. And the solutions that this report talks about are really based on some pretty reliable, predictable educator well-being. And it all comes down to the organization. It's responsive leadership and supportive culture. Where is that these days? I don't know, but that's what we strive for, right? Is to have a supportive culture, acceptance, adaptability, personal well-being, but a professional growth kind of orientation. And one interesting thing in this report is that it developed a survey tool that was generated by educators directly, and it really more accurately defines and engages educator well-being. But the other survey that we love, and I think Paul is on this webinar as we speak, is the Healthy Worker Campaign survey. We think that's a gem of a survey tool, and plan on rolling that out across all of our divisions to start tracking and getting data, because we're missing a lot of data on some of this material. And so that's a starting point, but the solutions really are for a connection, collaboration, and commitment from leaders to support well-being of educators so that they can in turn support their students. Can I say one thing about healthcare too?
Sure.
All right, so I just want to move to well-being in healthcare. This is actually really interesting to me because this is a workplace change collaborative that was funded by HRSA, that is made up by a whole bunch of people in the healthcare industry, healthcare world. All sides recognize that the healthcare workforce is really struggling. And these resources that were developed by this collaborative is looking at putting together a national framework for addressing burnout and moral injury, very different things in healthcare and public safety workforce. And they talk about the drivers, and this is the better slide. They talk about the drivers of moral injury, which is in a very comprehensive way. They look at what's causing it, what the process is, and what's creating it, and the outcomes that are experienced by folks in these industries. And so for me, this is a really interesting type of way to address this that's industry-based and has all the right players in there. But it talks about both relational and operational drivers of burnout and moral injury for different stakeholders. And it really comes down to building trust. Trust is what is missing. And having that ability to, management's going to come to us with one thing. We're not going to trust them because they've done all these other things. So it's reestablishing trust, which is the essential base to address these kinds of factors. So it's like, how do you engage and protect workers and learners? How do you support and develop leadership? How do you establish shared governance structures? How do you align values and address inequities? All of these things are based in trust. And that is really where you need to start before you can look at some of the operational drivers of these kinds of solutions. So that is, so like, how do you design change to workflows to reduce inefficiencies and create safe staffing levels? Huge issue. So we've taken a lot of this work, and this is brandy new. I will say that this report and this whole framework came out late last year, and we'll see how it works, because what it comes down to in the long run is, this is a tough task to take on. In some workplaces, they're addressing well-being in the workplace, others not so much. And, it's for us, it's working on trying to find, or some of these organizational and structural solutions to improve the lives of our members.
Oh, wonderful. Thank you. Yeah, I was going to ask you, and then the other panelists also, for where you have discovered opportunities to actually engage in a collaborative, what the forum has been for collaboration on some of these organizational changes, very deep, as you say. Of course, unions have, we're working things out with you, and then there are other alternatives for and we'll talk about that in a moment. But if you and the other panelists, I'll ask you if there have been opportunities to sit down and work collaboratively around these organizational changes.
I don't have many good examples to point to. Connecticut actually is one of them, where we're working at some of the hospitals at the state level to implement some of these things. But a lot of times this work is tied in with law, right? And so a lot of our affiliates are advocating for example, safe patient staffing levels. So, and ratios and things like that. So a lot of times we're working towards legislative change, because sometimes that's easier than trying to work just at the local level, where there's a little bit of a requirement for employers to have these engagement kinds of conversations. And I see it more in healthcare, less in higher ed, government services, and K through 12. So because there's less laws that impact those kinds of situations.
Right. And Tara, if you have, I know you've talked about the design team, and that is a labor management collaborative team, right, where you're working together on that. Are there other examples of collaboration where you have gotten to work together with DOC to make changes?
So not necessarily I've had the opportunity to work with DOC, but I've had the opportunity to work with an organization called One Voice United. And it's correctional unions nationwide. And I've had the opportunity to work along them. And what we've been working on is because we see that everyone in corrections is experiencing the same issues. So what we have been doing is working together nationally, on a national level, and coming together with one mission and one voice, and being able to go to the legislators and voice our concerns with them. So it's baby steps, but that's part of what I've been able to do as far as working towards issues with corrections, because obviously we have staff shortages in every job entity. So it's one of them. Each state is different, obviously. Some states suffer more than others, but the wellness and the staff shortages, we're all aware that that's an issue amongst all states. So that's one of our things that we've been working on to try and go to the legislators. Last year, I had the opportunity to, the year before, I had the opportunity to go to legislators, and we had the opportunity to speak about what the correctional staff are experiencing inside the workplace. So that's one of the organizations that I do work with.
Great. And Chris, examples of where members and or the M&A has been able to sit down and collaborate to address these issues at a structural level?
So it was some of the hospitals, that because we primarily deal with hospital acute care. So through the developmental, their education and developmental departments, we can get in there, if you will, use the term, we can enter and work with, but not all of them are open to that, meaning not all the hospitals are open to change or seeing the same issues as we do as advocates for our members. So I hate to make a statement that say none of them are cooperative, because some are, and those who are, we definitely have meetings with, either Zoom or we'll actually go in and actually work with them to try to address the staffing. For example, especially in our mental health facilities, within the hospital, they'll have a floor or two, either adolescent psych or adult psych. And we find that if we bring models of nursing in and trying to show where you have a certain amount of nurses, not only does care for the patient increase, but the violence goes down. So that's the sort of thing we do repeatedly. We do work with OSHA. They've been a great help for us as an outside agency. We collaborate with them. If we have outstanding issues with some of our hospitals, which we do, we report. And then, of course, internally, we have a legislative department that works with our state folks, if you will, our state leaders, and we have pending bills. We have workplace violence and safe patient handling from a health and safety perspective. So politically speaking, M&A is very active. I can say that much, and
Right.
Hopefully contributes to the wellness of the worker.
So it seems like between in these critical public sectors that you all represent, the issue of understaffing and other issues in the workplace environment, a poor environment leads to experience or perception of stress or potential stress, which makes it more difficult to recruit people, which leads to understaffing. And so that you're attempting to work with employers to solve their problem by participating with them in gaining a little bit more influence over the workplace seems to be definitely one of these potential solutions. But to go to, in addition to collaboration, of course, unions will work with contract language to change things. There may be other job actions, sick outs, other kinds of labor where labor, uses the power that labor has to make changes and to get changes. Do any of you have examples of what may be considered less initially collaborative approaches that might play some role in improving and getting employers' attention to make changes to improve worker well-being?
Sure, I'll jump in.
Sure.
Actually, last year we initiated a campaign called Code Red. I don't know if people have seen it in the slide. It's in the slides that I just presented, put in before. But it's a 3-year campaign that's addressing the major issues in our healthcare members, like the staffing, workplace violence, other things that you talked about, but also getting to the root of these issues. Which is really private equity investment and the corporatization in the healthcare industry, corporatization of education as well, both K through 12 and higher ed. It's a thing. But really how we're dealing with this is we're working through state and federal legislation, like I talked about in rulemaking, collective bargaining, communications, and really putting things together to help our members and our leaders. So we created a toolkit, and Sarah's on this webinar from AFT, and she was really instrumental in putting this together. A toolkit which has tools for bargaining, has sample contract language, it has training modules in it, all types of communication to share out to build a campaign, and really sharing out messages and shared goals and collaborative approaches around these issues. And AFT or healthcare division has been coordinating regular meetings so that leaders and staff can talk to each other, even from different states, and share successes and challenges with each other. And last year, the focus was on staffing. And all of our affiliates developed a campaign plans for their state around these issues. And, you know, in 2023, our affiliates won some major staffing legislation in Oregon, Washington, and Connecticut. And they're working on implementation this year. And now we're focusing on workplace violence, which is a huge issue. Yeah, it's a huge issue. Connecticut has already won new workplace violence protections. Other states are preparing because they're not all have yearly legislative sessions, so they're planning and putting all that together now. They're developing collective bargaining and committee resources and incorporating training on mental health and well-being. So that's one thing. It's called Code Red, and it's really cool. A lot of good work there.
Thanks. Tara or Chris, are there examples of worksite actions or collective bargaining or other labor initiated efforts?
I think that for us, just the start of being able to negotiate a day of wellness into our contract was great, because a lot of people don't have that in their contract. And the agency doesn't fight us on it. They're aware that we have that in our contract. So whenever we send our emails out to them and tell them that we're ready to have our annual wellness training, they're okay with it. Whatever platform we want to use, wherever we want to have it at, they're very supportive on what we have to offer, because they're fully aware that this is a problem. So that's the start for us. And that was a big win for us. And I know that there's a lot of other states and a lot of other unions that are trying to get that implemented in their contract that I work with. So I think that was a really great thing that we have done. And just every year going through and being able to implement the training is a big plus, because in the beginning, we didn't see it that much involvement and participation. And now we got more than half of our members coming to the annual wellness training day. So I think that was a good push for us.
Okay, thanks. And Chris, I saw you nodding your head when I was talking about this, so.
Yes, and thank you for Tara and Amy's comment. We, of course, the labor reps go in, and we are currently bringing in 2 other nurses and training them. And we have one who is sitting with our labor representatives in some hospitals addressing just workplace violence. That's, as Amy and Tara both know, this is such a huge area that we're actually going to train and have a nurse ready to just deal with this. And because we have organizationally promoted and are receiving reports. So that's one way of collecting data so that we can say, this isn't just something we're making up. This is real. Because consequently, the data is not there for incidents. So we're trying to capture what's happening on a daily basis, because workers' comp is when there's a claim made or when there's time lost. But the incidents of verbal and physical assaults that occur daily are not being captured. So we're trying to create that reality, which is huge. And I know it sounds easy to speak to, but the reality of it is it's a task in itself. So what we've done is we're bringing in a nurse just to do that. We've got our workplace violence committee. And I know it sounds like it's centered just on violence, but it's not, because when a nurse feels safe, or anyone feels safe in their work environment, that's less stress, right? We view stresses as an immune dysfunction contributor. We do not want to make people sick. So to us, any stressor you take away is contributing to health. And that's how we're looking at this specific issue. Thank you.
Great. Yeah, no, I love all your ideas that you're talking about, creative problem solving. And it looks like Tara wanted to.
Yes, I do. I'm sorry about that. We also, in the state of Connecticut, we developed it was a union initiative, but the agency has supported it, and the agency has taken it over and provided the resources that we need to have this program implemented. Was the employee assistant unit alongside the EAP, because we realized that the bottom-up approach was working for us. So the agency have implemented and supported an EAU unit for our members, for for the state of Connecticut correctional staff, they've implemented an EAU unit, and the EAU unit has expanded. It not only applies for the staff member, but it goes out. They'll find you resources for your family or whatever, and it's a direct line to them, and they it helps. It's a faster process than EAP. So I
Right.
think that is a great push that we have done in the state of Connecticut to help our members, regardless of what they're going through. It first started out with substance abuse, but now it's expanded, and you can call for anything now.
Right.
If they
So-
can't help you, they direct you to where you can get some support and help.
Right. So I want to get to our distinguished audience members here to ask questions. But before I do, I wanted to give each of the three of you an opportunity to ask any of the other two if you had questions for them, and then we will go to audience questions.
I don't have a question. I just have I want to fully support what Christine said about reporting. There are so many barriers to reporting incidents where people don't go into the workers' comp system, or near misses. And that is what this is our message to people. Like, we need to report, because if we don't report, we don't know the problem. We can't get to the root cause, right? But there's so many barriers. It takes a lot of time. They're already overworked. In some cases in K through 12, they have to do it off work time. And there's a feeling where nothing's going to change anyway. So that's
Right.
the hurdle we have to get over, and document why data is so important. I'm all about the data.
Yeah, it's
Thanks
a
for
very
that.
good, very good point. I'm glad that, as researchers, we can potentially play a role. That was also one of our questions. What role can researchers play in assisting unions in dealing with these structural issues? Certainly, if you are documenting incidences of violence or short staffing or whatever it is that can lead to stress, the employer can't say, oh, well, the solution to your burnout problem is that you get therapy, or the solution to your workplace stress is that you eat chocolate. Okay, so I really want to thank all of our participants. Thank you so much, and our audience members as well. We have an evaluation survey that is in the chat, and we hope that you'll take that. And here is our information as well. If you want to follow up on our programs, again, I'm going to put in the pitch for taking our course on total worker health employer crisis preparedness, with its focus on mental health. We will wrap up, and thank you very much for your participation.